Hey everyone, and welcome back to my channel. Today, we're tackling a really important topic that affects millions of men worldwide: prostate cancer. It's a subject many of us might shy away from, but knowledge is power, and understanding it is the first step towards better health for ourselves and the men we care about. So, what exactly is the prostate? It's a small, walnut-shaped gland that's part of the male reproductive system. Its main job is to produce the fluid that nourishes and transports sperm. Prostate cancer happens when cells in this gland start to grow out of control. It's actually one of the most common cancers found in men, especially as they get older. Now, let's talk about the risk factors. The biggest one is age. The risk of developing prostate cancer significantly increases after the age of 50. Family history also plays a major role. If your father or brother had it, your own risk goes up. There's a genetic component too. Certain gene mutations, like BRCA1 and BRCA2, which you might have heard about in relation to breast cancer, can also increase the risk in men. Lifestyle choices matter as well. Things like a diet high in fat, obesity, and not getting enough exercise can contribute to the risk. And interestingly, race is a factor, with men of African descent facing a higher risk than men of other races. One of the trickiest things about prostate cancer is that in its early stages, it often has no symptoms at all. This is why awareness and screening are so vital. When symptoms do start to appear, you might notice things like needing to urinate more often, especially at night. You might have difficulty starting or stopping the flow of urine, or the stream might be weak or interrupted. In some cases, there might be blood in the urine or semen. If the cancer has advanced and spread, it can cause pain in the lower back, hips, or pelvis. If you experience any of these, it's really important to talk to a doctor. So how do doctors diagnose it? It usually starts with a conversation about your risk factors and any symptoms. Then, there are two common initial tests. The first is the PSA blood test, which measures the level of a protein called prostate-specific antigen. High levels can indicate a problem, though not always cancer. The second is a digital rectal exam, or DRE, where a doctor physically feels the prostate for any lumps or hard areas. If either of these tests are suspicious, the next step is usually a biopsy. This is where a small tissue sample is taken from the prostate and examined under a microscope to confirm if cancer cells are present. If cancer is found, imaging tests like an MRI or CT scan might be used to see if it has spread. Now, if a diagnosis is made, what are the treatment options? This really depends on many factors, like how aggressive the cancer is, whether it has spread, and the patient's age and overall health. For slow-growing, low-risk cancers, sometimes the best approach is active surveillance. This means doctors just monitor it closely with regular tests without immediate treatment. For more aggressive cancers, options include surgery to remove the prostate, which is called a prostatectomy, or radiation therapy, which uses high-energy rays to destroy cancer cells. Other treatments include hormone therapy, which works by reducing male hormones that can fuel the cancer's growth, and chemotherapy for more advanced cases. There are also newer, exciting options like immunotherapy and targeted therapy that are becoming more common. The good news is there's a lot we can do to lower our risk. Prevention starts with healthy habits. Maintaining a healthy weight through a balanced diet and regular exercise is key. Focus on eating plenty of fruits and vegetables. Some studies suggest that foods rich in antioxidants, like the lycopene found in cooked tomatoes, can be beneficial. It's also a good idea to limit red and processed meats. Most importantly, have a conversation with your doctor about whether PSA testing is right for you, especially if you're over 50 or have other risk factors. The key takeaway here is this: many prostate cancers grow very slowly and may never become a serious threat to your life. That's why early detection and regular checkups are so incredibly important. Don't be afraid to talk about it, and don't delay seeing a doctor if you have concerns. Your health is worth it. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and share it with the men in your life. Don't forget to subscribe for more health content. See you in the next one.